Hello and welcome. My name is Georgiana Bostein, and I'm an Associate Professor of Environment, Health, and Policy at Chapman University, where I teach the GIS course. And today we'll be talking about what is GIS and how is it potentially useful for contact tracing efforts. So I've broken up this workshop into two parts. Today, in the first part, we're going to talk about what is GIS and sort of big picture concepts about how you could use it and what are the things that you need in order to conduct a GIS analysis. And in the second part of the workshop, we will do a hands-on analysis using an online spatial analysis program called ArcGIS Online. All right, so in this first part of the workshop, we're going to cover two things. The first being, what is GIS and why would we use it? And the second is, how can GIS be useful in contact tracing and enhanced contact tracing efforts? Okay, so I've said GIS several times now. It is Geographic Information Systems. So an information system contains pieces of information. A geographic information system contains specifically geographic or spatial data, and it can be from multiple sources. And that's really the power of GIS, is that you can combine information on housing, on healthcare availability, on socio-demographic characteristics of the population, on resources available to the population. And by combining all of these, what are called layers, into one map, we can perform all sorts of analyses to look at what are the nearest facilities, the nearest resources, where are clusters of cases located, or clusters of resources, or a dearth of resources, for example. So GIS is used in nearly any field, from urban planning to transportation, to natural resource management, to water utilities. And so you'll find GIS across a variety of different fields. And it's actually, in terms of research, can be useful in very many different academic fields as well, from history to archaeology to sociology, which is my own background. And so GIS is extremely powerful, and I hope that you might get some ideas from this workshop that may even go beyond contact tracing. So GIS is powerful because it allows you to take a spreadsheet of data that might otherwise be overwhelming amounts of information and identify spatial trends, patterns, and potentially associations that you wouldn't necessarily see just in the spreadsheet. So here we see a spreadsheet of data on migration flows. Very difficult to interpret. That very same data, when mapped out, is far more powerful. And you can immediately identify patterns by mapping that data. So it helps you explore your data in ways that just looking at a spreadsheet doesn't. Find spatial patterns and trends, again, in ways that you couldn't with just a spreadsheet. And for some fields, it might be helpful to communicate your data beyond just analyzing it. Maps are a really powerful way of telling a compelling story. So as I mentioned, GIS is used in nearly every field. So you can study anything from socioeconomic characteristics at different geographic units of analysis, or geographic levels, right? We can look at country level differences, or we can even look at differences between different census tracts or block groups or neighborhoods as we define them. We can look at environmental topics or urban characteristics, historical data, political data, and what we're going to be focusing on today, which is health data, right? So many potential uses for GIS. So what do you need to conduct GIS analysis? Really, GIS combines two types of data: spatial data and attribute data. So attribute data you can think of as that spreadsheet that you're all probably pretty familiar with. And the spreadsheet just needs to have some geographic identifier. So maybe there's addresses. Maybe there are cities or zip codes in the data, or countries if your unit of analysis is the country level. And then you would also need a spatial file. What's called a shape file is one type of spatial data file for the geography of interest that is in your attribute data. So say your attribute data have zip codes and you want to conduct a zip code analysis, then you would want a shapefile of zip codes. I'll add the little asterisks, though, that we're going to be using ArcGIS Online, which in many cases already has capabilities of containing some of these geographies within the online program so that you don't actually have to upload a separate shapefile. Although you can, if there are areas such as census tracts which aren't recognized immediately by the program, we might upload our own census tract data, for example. But the power of ArcGIS Online is that there's a very, but far less steep learning curve than some of the other GIS programs. So that's what we're going to be using in our second part of the workshop. So how can GIS enhance contact tracing? Well, GIS can be used to understand epidemics more broadly. First of all, we can map cases, right? Confirmed cases, active cases, recoveries, fatalities, and identify where infections are clustered, for example. We can also look at temporal trends, mapping. If we use time-enabled maps, we can map the cases over time. We might map where there are vulnerable populations to target efforts to protect high-risk groups in the area. We might map capacity. So we've seen lots of dashboards that have hospital capacity, for example, resources such as ERs or ICUs or other services that might be needed in a particular epidemic. So there are lots of ways to use GIS to understand different aspects of epidemics. Specific to contact tracing, we can even create dashboards that give multiple contact tracers immediate information on how many total cases are there currently and how many associated contacts with those cases, and how quickly are we able to make contact with those, follow up with contacts after identifying them, and so on. And this helps to make the process of contact tracing far more efficient when people have access to real-time information. And specifically as a contact tracer, you might gain a lot of insight into your data by looking at it on a map. So you might be able to find where there are cases and contacts, right? Instead of just looking at a spreadsheet of addresses, we can actually map those addresses and see, are particular cases clustering in an area? Are our contacts in specific areas or specific regions? And how many of these positive contacts can we link back to a specific case or even a place? For example, if we have part of our spreadsheet contains information on locations visited in the past 2 weeks, we might map those and see if there are common locations that multiple contacts have visited. We can aggregate cases to different boundaries. So rather than just looking at the residential addresses, maybe we want to know, are there differences in the number of cases in some of the housing on campus versus other parts of the housing, right? So the Palo Verde housing complex versus, I don't know what other housing complexes there are at UCI. You can fill in the blanks there, but maybe we can aggregate these cases and the dots from these addresses to these broader neighborhoods, if we have boundaries for those, to identify areas with substantial cases or contacts that we might need to target our efforts to. We might add contextual data. So I mentioned one of the very powerful elements of GIS is the ability to add information on nearly anything contextual. Lots of different what are called layers. So we can add a layer that looks at income or household size or median age in particular neighborhoods. We'll call them neighborhoods for now, and we'll talk more about the geographies in a bit. But GIS allows you to incorporate this contextual data, and it also helps to identify some of the nearest resources in some cases. Maybe we want to be able to direct people to the nearest testing center to their house or the nearest hospitals, or maybe they're having food insecurity issues. And so we can identify some of these really important resources, senior centers, for example, and do those types of what are called spatial analyses to identify these resources. Okay, so now that you have a basic understanding of what GIS is, the second portion of this workshop is going to let you dive right into using an online GIS program called ArcGIS Online.